Are you experiencing one-sided weakness with lateral pelvic tilt with quadratus lumborum tightness and stiffness on one side, and the opposite side with a lot of glutes weakness? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, I'll be demonstrating one-sided lateral pelvic tilt realignment with strengthening your glutes muscles and opening your tight quadratus lumborum in the opposite side. So in this video, I'll be demonstrating with elastic band. If you don't have elastic band, you can still join me for absolute beginners, and I'll help guide you to regain your life without back pain, to have a stronger core and improve posture, as I'll be reopening my back masterclass this July 1st, and June 30 will be for the first come first serve basis for the early bird waitlist. If you're interested to be guided by me with my weekly Zoom calls, click the link on the description below, write your name and email address, and be part of my free 6-part video series. And if you want to join my 8-week course, join and I'll help you, guide you, meet you face-to-face in my Zoom calls. So get your mat ready and join me now. We're going to place the elastic band around your thighs. And I love this program because if you have excruciating pain, if you don't know how to start to regain your balance, sometimes it's just that tilt, and that area where you are lower, usually that's where you have more impact on your knee, on your hip, and then the opposite side is overspasmodic. Example, if your left side is lower and weaker, then your right side quadratus lumborum is overworked. And also have cases where it's the same side, everything is same side. It also happens because of the impact from this side, the left side, there's also quadratus lumborum pain on the left, but it's more common, it's a crisscross pattern. The hip is weak, then the opposite side is overworked on the paralumbar muscles. So let's begin the program. So we'll start lying on your back. Place your hands behind your thighs, slowly roll down one vertebrae at a time. And I love to start engaging your pelvis. So if my left side is my lower side, and you can check it out, I have a video you can check out over here about lateral pelvic tilt to realign first before and find out which one is your lower and longer functional leg length, which means it looks like a longer leg, but it's not the bones. It's actually the tilt of the pelvis that makes it look like the other side is longer, lower extremity. But usually it's the tilt of your pelvis, and we need to realign it by improving the weakness of your hip flexors and then lengthening the quadratus lumborum, the opposite side. At the same time, improve the glute strength on the opposite side. So if this is your weaker hip flexors, I have patients with weaker glutes on the opposite. And then there's more problem on the opposite side, or I have also clients with the rotation of the pelvis. So because they're rotated anteriorly on one side, then there's more pulling on the lumbar side on the opposite side. So you want to make sure you know what's the alignment. If you have placed a cup of coffee here, you could feel where the tilting of the cup. So if I'm leaning on my left, a little bit rotation to the left, then I'm spilling it to the left. So we need to lift and engage this left side. So let's pretend the left side is my weaker side, which is true. My left side is my weaker side. I'm going to start bending my knee to 90 degrees first. You want to make sure you engage your core and zip it up and breathe out. And place your hands on top of your thigh to press against it, keeping the other knee bent to support, and the elastic band gives you that extra resistance. Mindfulness on the opposite thigh, on your posterior chain muscle, and then in front of your thigh, and take a deep breath. Breathe in and breathe out. Press, hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And my recommendation is do this 10 repetitions, 10 times, and my left side, I could really feel the isometric and the burning inside of my hip flexors. And the hip flexors, the iliopsoas starts on your lumbar spine, the psoas major, and the iliacus, which is the ilio, the part of the iliopsoas, the iliacus starts on the iliac crest, and they bundle together to come together to insert on your hip joint to be the iliopsoas. So it's very deep. It starts from your low back, going to the front, sliding forward. So it's the prime mover of the hip. So if you don't have strength on your hip flexors, it's hard to propel forward to walk. Again, inhale, expand your ribcage. You want to make sure you breathe in through your nose, expand laterally on your ribcage. You don't want to lift your shoulders up, keep your shoulders down so you're not using your neck muscles and your chest to breathe, but diaphragmatic. Expand your ribcage and then zip it up, breathe it out from your lower abs to your navel. So you're lifting your pelvic floor and then lifting your knee to tabletop. It's a sequence event, and then press gently, not too hard that you ended up pushing too far. Close your chest to 90-degree bend to tabletop. If there's a cup of coffee on top of your leg, you don't want to spill it towards you or spill it down away from your foot. Keep it knee bent to 90 and press and hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And this is great for those with SI joint dysfunction. You're lifting this up. Your SI joint is relieving on your left side. Take a deep breath. Don't forget your breathing. Exhale, press and hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. After 10 repetitions on your left, now I'm interlocking my fingers, placing it behind my thighs. Despite the elastic band around my thighs, it's nice to interlock it also. And I'm pushing against away from me, keeping my foot, toes pointing away, 90-degree bend on my knee, placing a cup of coffee and pressing away from it and hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1 with my breathing. So take a deep breath. You can see my belly rising, diaphragmatic lateral rib cage flaring to the side, and zip it up. Bend to 90, interlock my fingers behind my thigh. If you can't reach behind your thigh, you can use a strap or a towel and push against it. And you're gonna feel that deep ache inside your pelvis and push away from you, but keeping that 90-degree bend and hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Last set, my friends. Inhale. Exhale, press against it and hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And my recommendation is 10 repetitions as well. And you can do this up to 3 sets a day, breakfast, lunch, and dinner, to keep realigning that pelvis. If you're sitting a lot, standing a lot, and walking, it's nice to take a break for any prolonged positioning. And now, after you do that realignment, now your pelvis is a little bit more aligned. You can check it on your iliac crest. As I said in my previous video, you can check out how to align it. It's the top of your pelvis here. You feel a bony prominence here, and then you, from your both thumbs on top, you check if they're aligned. So now I feel more aligned now. And now we're going to glue them together. I recommend placing a ball or a soft pillow between your knees and squeeze it together in the middle. For advanced, or those who can tolerate it without back pain, you can lift your both legs to 90 degrees and then make a fist and place it between your knees and squeeze it together in the middle and hold it for 10, 9, 8 with your breath work. I'm squeezing my core in, engaging everything, and hold it for 10 seconds. Hold with my breath work and then rest. If there's any pain, just squeeze it with your feet down. For those who can lift it up and hold their core together, we are gluing the pelvis. We're gluing all this misalignment, and hold it for 10 seconds. Hold. And after gluing them together inward for the hip adductors, now we're gonna engage the hip abductors. So you're gonna place your hands outside your knees. You can also wrap around a leather belt or any belt that you can wrap around your thighs, in keeping it aligned your knee and your hip. And I'm placing my hands instead and pressing against it with my arm strength. If you have good arm strength, I'm pushing against my hands, keeping it center, and I'm gluing my hip abductors and holding it as well as 10 seconds hold with my breath work. As I inhale, zip it up and press. 5, 4, 3, 2, 1. And as I said, if you can't keep it 90 degrees because of excruciating pain, place your foot down. Place the belt because you can't reach it, and I'm pressing against it. I'm pretending there's a belt. I'm pressing, opening my knees out, but keeping it centered with the belt. And after 10 reps now, we can start mobilizing our hips, our pelvis. My favorite exercise for my absolute beginners is take a deep breath, zip it up, and slowly lower one knee out to the side, keeping my other knee pointing to the heavens to open my hip groin, my hip, and keeping my core engaged. If I place a cup of coffee, I'm not spilling to the left. Keep it center. And then inhale back center and then switch to the other side. So this is hip fall out. And do that 10 repetitions each side. So this is one of my blueprint of my back masterclass that you can access slow progression for the next 8 weeks, every day, gentle 10 to 15 minute workout that you can start improving your core, realigning your pelvis, improving the posture awareness. If you have back pain, poor posture, and weak core, using Pilates, yoga, and physical therapy fused together. I'm so excited to meet my new students. So alternating left and right, and you can hold it for 5 seconds, hold up to 10. For absolute beginners, you can just slowly, just left and right, just gliding through, mobilizing your pelvis and your hip joints. I know your pelvis is a joint also. 3 bones on the left, 3 bones on the right, and you're mobilizing it, especially with SI joint dysfunction that feels misaligned. And when you mobilize it gently, not to the point of excruciating pain. Well done. Now, after the hip opening, now I love my butterfly. Opening my knees out, feet together, just gently open as much as you can with the elastic band against it to engage your hip external rotators. And then back center. Breathe in, expand, zip it up, and open. And you can use your hands also facing to the heavens as you breathe in. Breathe out, open. Breathe in, open. Squeezing my core in. And hold it for 5 seconds for absolute beginners. Up to 10 seconds hold. 10 reps. And after those gentle hip mobilization and hip opening, now I can do my tabletop. Bend my knees to 90 degrees. As I breathe out, lift my knee to 90 as I exhale. And I also could use my upper body. So as I lift my left, I'm lifting my left hand, same side, and then down, and then switch to the other side, bending my knee to 90, hands pointing to the heavens, and breathe out. Mindfulness, slow control. Try not to plop your foot as you place your foot down. You want to be slow controlled. Mindfulness, slowly engaging your slow twitch muscle fiber. I'm really engaging it slow and steady. So the elastic band gives a gentle resistance. Making sure you're doing the proper breath work as I breathe in and breathe out. Inhale, expand, and lift to tabletop. Together with the same side movement, I'm engaging my same side of my core. And after doing same side, if you feel like the left side is weaker, do an extra 5 reps on my left. So my left side is my weaker. I'm doing 5 reps more. So you can do same side like this. So 5 reps for an extra engagement and engaging those deeper core muscles and abdominal muscles. Just tapping my toes and my fingers gently on the mat as I go down and lift it up and exhaling. Inhale as I tap. Exhale as I lift. Last one. So if your right side is your weaker side, do an extra on your right. After doing same side, now this is a modified dead bug, which is lifting my left foot and lifting my right arm. So this one targets your obliques, which is important for trunk rotation, but you want to keep it stable. So we're stabilizing it and breathing out. So I'm lifting my left knee to my chest, toes pointing away, and then my fingers pointing to the heavens as I lift and breathe out. Inhale as I tap. Arm overhead and then lift. 3 more. And my recommendations is 10 repetitions each side with an extra set on the weaker side. So I'm doing an extra set of my left hip flexors. And then don't forget the other side too. I like to balance my body. And this is my stronger side as I lift my right knee and then my left hand pointing to the heavens. Even though it's the good side, this becomes a mirror effect on your weaker side. Inhale, tap. Exhale, lift. Squeezing my core in. Mindfulness. 3 more. 2. Last one and 1. And now we're going to do hip abduction in tabletop. So you can start with your hands pointing to the heavens to challenge your core. I'm starting with my left to tabletop. As I breathe out, slowly open my knee out to the side, keeping my other knee pointing to the heavens. My foot down, I'm not twisting my spine. If there's a cup of coffee in the middle, I'm not spilling it. As I gently open to the side. So I'm opening my left arm as well for that mindfulness and guidance. And then inhale, back center. Exhale down. And then switch to the other side. I'm bending my right knee. Breathe in and breathe out, open to the side. Inhale, center. Exhale down. And then you can add variations. As you open, I'm not lifting my hips off the mat as I open. Center. And then lower my foot down as my arm is overhead. So my starting position is arms overhead, same side. Right knee bent, hand pointing to the heavens as I breathe out. Open to the side, slightly without twisting my spine. Center, and then arms overhead. We'll do this 5 more times. Stabilize, bounce. It feels so good on the hip flexors. As I inhale, exhale, lift. Center. Right arm. Inhale, exhale, open. So you want to make sure you really open gently. Lift, open, center, down. Inhale, lift, open, center, down. Mindfulness. Well done. After doing those beautiful movements, we're gonna extend one leg. So this really targets your hip flexors with my toes pointing to the heavens. And you can do a little bit core engage. Arms overhead as I lift, reaching to my opposite leg. So I'm reaching with my left leg. As long as there's no pain, gentle core engagement and breathing out. And then dorsiflex, toes pointing you. And then slowly lower your foot down, arms overhead. Tippy toes, and then lift with a gentle chin tuck. Dorsiflex, exhale down. Inhale, toes pointing away as you lift. I'm focusing on my left hip flexors, and then dorsiflex, and then slowly lower. 2 more. And then switch to the other side, bend my left knee, extend my right knee, and then toes pointing away as I inhale. Expand my ribcage, zip it up and lift. Dorsiflex and down. Tippy toes and lift. And down. 3 more. And my recommendation is do this 10 reps. I'm just showing you the blueprints of some of my lovely Pilates, yoga, and physical therapy core back immersion inside my back masterclass. Well done. We are cooling down now. We're gonna do a gentle butterfly stretch with hip thrust. So as I open to W position on my arms for my core engage. So hands and elbows together, knees together, open. And from this position, thrust. And then hands and elbows together. Then open and then roll down 1 vertebrae at a time with your knees out. So again, so you're gonna start open, thrust, hands and elbows together while holding that thrust. Open again to W position and then roll down 1 vertebrae at a time and breathe out. Knees, elbows and hands together as I breathe in. Breathe out, open. Again, if this rolls up a little bit, that's fine. This is more the cooling down now. It's okay to roll it up on your hips. Open as much as you can. See, I'm really opening my pelvis. This is good for pelvic floor health. Pelvic floor is part of your core. Thrust as much as you can without overarching your spine. Inhale, exhale. Slowly roll down 1 vertebrae at a time. And then hands and elbows, knees together. Inhale, exhale. Open, thrust, and then hold that thrust, hands and elbows together, and then open and roll down. Hands and knees together. Inhale, exhale, open, thrust, hands and knees together. Open your arms out again. Please down as you roll down 1 vertebrae at a time. Last one. Hands and knees together, W position. Open. So you're gonna open as much as you can. Thrust. Hands and elbows together. Open. Roll down. Let's do 1 more time. And now figure 4. Placing your foot on top of your thigh. I'm starting with my right and really hugging my knees to my chest. If you can't hug your knees to your chest, you can just push your knee out or pull it in back and forth for those beginners. But for those who can challenge, hug. Extend the opposite leg, dorsiflex before bending your knee again, and then lowering your foot down and figure 4 again. Again, hug, extend, toes pointing away, dorsiflex, bend for flossing sciatic nerve, and mobilizing your piriformis and hip joint. Inhale, hug, extend, dorsiflex, floss, down, breathe out. Last set. And then switch to the other side. Figure 4. Hug, extend, dorsiflex, down, and lower down. Feels so good on your hip, your piriformis, and your sciatic nerves to floss it. And my recommendation is to do 10 reps as well. Feels so good on your hip joint, especially if you've been sitting a lot, standing or walking all day. Last one. And that's it. I'm hoping you enjoyed this lovely back masterclass introduction. If you decide to join, click the link on the description below. Be part of the Early Bird Waitlist for our first come first serve basis for June 30. I'll see you inside the class. If you have more time today, check out this video of my core back immersion episode 1, what is core back immersion, and learn more about it. And this is episode 2 to learn about proper breath work. Until my next video training, always remember, be safe, be well, and healthy you. Bye.